Welcome to The Virtual Shift, a show looking at the seismic changes happening in healthcare with virtual care at the epicenter. Join me and my guests as we look at key cultural and policy shifts impacting how providers, payers, and patients connect, as well as how care is being reimagined both for today and the future. Hello, and thanks for tuning in today. I'm your host, Tom Foley. You can learn more about this show by visiting the program on healthcarenowradio.com, and be sure to follow me on LinkedIn, Twitter at FoleyTom, and the hashtag The Virtual Shift. Today we have a great guest on. His name is Soheil Saadat. He's been a guest before. He is the founder and CEO of GenieMD. Soheil, welcome to the program.
Hello, Tom. Thank you for inviting me back here to your wonderful program.
Soheil, HIMSS is coming up. Your organization is right smack in the middle of the healthcare industry, providing a virtual care platform. Tell us a little bit about GenieMD and what we might see at HIMSS.
So, Tom, we have a long history of being in health IT. Many years ago, we were one of the early adopters of mobile technologies in healthcare, the humble beginnings of managing personal health data and expanding it to caregivers and managing the coordination of care. And all the way to doing telemedicine and remote patient monitoring. What we're going to be showcasing during this HIMSS conference is a concept we call GenieMD CONTINUUM. And basically, it is a platform that provides connectivity, workflow, data exchange between all of the stakeholders managing a person's health in a virtual setting. And what we are pushing basically is a move from a typical episodic encounter in virtual care, we call it urgent care, to moving to primary care where there is a longer doctor-patient engagement, including laboratory tests and imaging and so forth. All the way to taking health care to a person's home and managing the person's health while they are at home. And going beyond that a little bit is offering solutions that is more of a lifestyle application with a significant emphasis, of course, on health and virtual care. But there are many other aspects of life that can be managed within that same platform and same concepts.
Yeah, that's what I like about GenieMD. Such visionaries in the field and always thinking about where the market is going and meeting the market, but yet satisfying the market where they're at today. So the idea of a customer engaging and knowing that they have a platform that's just not compliant with today's model, but also gives the ability to grow relative to where the market might be going. And in the context of the home becoming the setting of care and the virtual care being an extension of the brick and mortar facilities, it seems like GenieMD is locked and loaded in that particular space.
Yeah, in general, all industries are going through kind of disruptive periods, and these disruptions are because of new technologies that are available. And these technologies are all the way from better communications, 5G communication, to better access to services on the internet, long list of additional services that are developed by other entrepreneurs in the market that you can integrate in a seamless way to provide better services. But for a company to basically flourish and survive in this market, you need to have two things. One is you need to have a flexible, modular, and scalable platform that can adapt to the ever-changing requirements of the customers, regulation changes, and things along those lines. And you also need to have an agile development team that can develop, modify, rebuild these modules in a new setting to address a new application. And I think GenieMD excels in those two areas, having a very flexible modularized platform and an extremely agile development team.
Yeah. So instead of the norm of, hey, I got a remote patient monitoring platform, just cookie cutter from health system to health system, it might be, I want a remote patient monitoring platform, but I want this particular spin on it because I offer a particularly unique platform or unique service to my customer base, and GenieMD's is nimble enough to address that unique need.
Absolutely. I have not come across two customers, enterprise class customers, that their requirements are identical. Every customer has their own unique requirements to meet their business processes and business objectives. And it is not that we are going to be writing programs or rewriting significant parts of our platform. It's that the key is that the platform has components, that these components can kind of like a Lego system can be put together in a way that you meet the requirements of a new client in a short period of time with a low cost of development and basically meeting their requirements as they specified.
Yeah, and sometimes, when people hear potentially, they might be interpreting what you're saying as customization. Customization typically brings a higher price tag, if you will, and thinking that, a lot of times in healthcare, people buy on price, not feature function. But it sounds like, as I know, GenieMD being very competitive on the investment side of the house, that a health system or an adopter of the GenieMD CONTINUUM platform might need to make.
Let me just give you an example. We actually tried to stay away from doing COVID testing, and because we always have a kind of a long view of our business and products and applications that we develop. But we had some clients that they wanted us to provide a platform for their management of employees across many states while they go through the test. And literally in a matter of 10 days, we changed some of these Legos and added a few very small modules to our system that made it a really fantastic COVID test platform. And literally, as I said, it's just the days that took us to do this. So that's basically what I'm talking about, is we are not writing code or going through long processes of specifying the modules, but basically putting the modules together in a different way to meet your requirements.
It's interesting. So let's shift the conversation a little bit. Let's talk a little bit about the home. On your website, geniemd.com, you talk about the continuous care. And I love that phrase because I think it starts to create this connection between the episodic nature of delivery of care and what that patient is actually doing when they're at home. So continuous care makes absolute sense, and you tie that in with, and you do that obviously through your virtual care solution set. How do you see the home in the next 2 years?
Well, I see home to be your kind of personalized hospital. It's a place that you feel most comfortable with. You're familiar with the surroundings. It's home. And if, regardless of your condition, if the services that you need to manage your health can be delivered to you in your home, that is basically what our objective is. For example, imagine that parents kind of live in their home and they have a fall, and we don't know if they've broken anything or now it's one way is to kind of drag them into a car or call 911 and have them ported into an emergency room to go through an X-ray or a CAT scan. The alternative in this extreme case is to send imaging to your home. And they can bring in the imaging equipment and figure out if you have a broken bone. Now, that's, of course, a more extreme case, but in many other aspects of managing a person's health is medication management, keeping track of their vitals, make sure that their blood pressure is under control, their glucose level is under control. And to a great extent, some of that kind of leads into remote patient monitoring, as we call it, where you can monitor a person's vitals, adherence to their care plan remotely, and then have friendly ways of reminding them to do the things that they need to be doing to stay healthy. And one of the other components of this is to involve the family members, give the family members visibility as to what's happening to the parents, to the elderly parents. So these are all the different kind of services that we provide as part of our GenieMD continuum.
And so does that include things like for when you talk about, you talked earlier about lab integration, having samples collected, a lab order taken and captured in the home and then shipped out?
Absolutely. And at times there are tests that collection of those samples is not something that the patient might feel comfortable. And in that regard, you can imagine that a visiting nurse or even an MA could come and visit you at home and collect those samples. The other thing that I think is going to happen for many of the elderly that are suffering from more complex conditions is more and more biologic medications. And these biologics, many of them are injectables. And often people are not comfortable kind of injecting medications in their own arms. So they having a service that will provide this particular function would also be of significant value. And then you can kind of talk about or think of kind of simpler things, right? Delivering your medication. So from the time that you're not feeling well, you do a telemedicine visit, and then an hour later, somebody knocks on your door and delivers your medication at home is one of many, many different things that we are thinking of offering to our patients.
Interesting. And I would imagine that has stepping stones into, I have this platform. The home is the setting of care. I'm able to get meds delivered, labs taken, engagement with my provider and or the care team, remote patient monitoring, medication adherence, right? Those are all things, all the buzzwords of, virtual care. But you talked earlier about lifestyle. And in that home, it sounds like you're ultimately, that home is becoming an intelligent medical home, and that there's more about that patient, about that ultimately influences their delivery of care. Tell us a little bit about that.
Absolutely. I think we are social beings, and there is a lot more to life than kind of worried about antibiotics. So imagine a community of homes that, as you called it, are kind of smart homes in that regard. Every person has a very nice looking tablet by their bedside, and this tablet is not only used for your communication with a provider in case you're not feeling well, but it also serves as many other things. For example, you live in a golfing community, and you had a episodic issue, but you're substantially healthy, and you like to kind of do a booking for your tea time. So you just kind of push a button on that same tablet and get a tea time. You might want to take your spouse out to a nice dinner and be able to do that as well. Maybe you have a doctor's appointment, and wouldn't it be nice if a button showed up and you pressed it and you reserved Uber that came and picked you up? So all of those additional services that will complement things that you do to stay healthy, I think is also equally important in the quality of life and being in a state of mind that not only you're physically healthy, but you're mentally healthy, you're engaged, you're social, and you're enjoying your life.
Yeah, I would agree, Soheil. And at the end of the day, it's really, to your point, it's really about that whole person. It's not about the episodic model. It's not even to some degree about value-based care. While those are important, they will always have a place in the delivery of care model. However, the whole person, which the doctor typically doesn't see, because you don't necessarily bring the whole person, if you will, into the brick and mortar facility to understand who they truly are. They're there because they're complaining about a headache, a cough and cold, pink eye or something of that nature. But there's more to that person, and that person wants to engage. They just and be able to tie things together, if you will, to help them and their lifestyle. So really, really innovative stuff that GenieMD is embarking on. It really is a visionary view of where the delivery of care is going. It's not just about the here and now. It's about where the market is going. And certainly GenieMD is looking to position themselves well in that particular space.
Yeah, just one kind of quick comment is that we should also remember there's this thing called social determinants of health.
Yes.
And providing tools and utilities and exposure to services that are available to the underserved through this platform is also an objective that we are pursuing.
It's interesting. Again, GenieMD doing all of what they're doing, but you don't necessarily hear a lot about them. Tell us a little bit about the why in that. I don't want to digress too much, but you do have a very significant footprint in some very large health systems and pharmaceuticals, but I don't know if the average person who's interested in adopting a virtual care platform actually knows all of what GenieMD does. To some degree, they're flying under the radar. Any thoughts or insights into that?
Yeah, so I guess at the end of the day, you can always blame the CEO, and I'm willing to take blame. But that being said, and I have done this in multiple companies that I started, it's just you're either visible to the world or you are the brand behind, you are the Intel inside. And so far, we have been Intel inside. We have been behind other companies' brand. We have been private branding our application and being quiet about it, mostly because some of our larger clients, they do not want to say that this is not our product. They would like to say that this is our product, which is perfectly fine with us. But as you will see, as you're seeing over the past year and moving forward, you're going to see a significantly more exposure of the brand GenieMD, and we're hoping that more and more enterprises will give us an opportunity to present to them this wonderful platform that we have created and see if they can utilize the platform for what they're doing.
Awesome. So we have about 7 minutes left. I want to come back to the beginning and talk a little bit about HIMSS. So GenieMD is going to be in booth number 4959 at HIMSS. And I believe that's going to be on the main walkway, so very easy to find them. So that's exciting in and of itself. Tell us, I think if I recall from previous conversations, you have other folks that are going to be in your booth to demonstrate what you say you do, and in the context of device interoperability and specific treating of specific chronic conditions. Can you tell us a little bit more about that?
Absolutely. So we're actually pleased and honored to have two of our partners, AliveCore and Vocare, to be in our booth. We are showcasing our integration with their unique products. You're going to be able to come in and put your two fingers on an AliveCore ECG device. They have a new, actually, credit card size device, and see your ECG and see how it gets stored in our system very seamlessly, how that information becomes readily available to the provider during an encounter, how it is visible to the caregivers and care managers. And same with Vocare. Vocare has a very interesting and unique product that measures multiple vitals in a very beautiful package, almost the size of an iPhone. Measures blood pressure, SpO2, glucose, etc. So please stop by and see how we integrate with these two devices. But suffice to say that as much as we value these partnerships, but we are also device agnostic, and we can offer many other devices that we integrate with. And if a particular health system or clinic is interested in a particular set of devices, we can also develop those drivers for them. So that's one area that we're going to be showing at HIMSS. And then also we're going to be announcing a number of additional partnerships and distributors that are going to be providing our products and services, not only in US, but internationally.
Yeah, well, that's the other exciting element of GenieMD. They're just not a U.S.-based company. I always say that when you work globally or internationally, and you get exposure to other health systems and the way they do it, you ultimately have the opportunity to mesh the best, if you will, into a solution. And I think that exposure internationally definitely creates a differentiation in and of itself. While some might call it socialized medicine in other countries, some countries, even in Europe, they have some pretty interesting things that they do and how they approach the delivery of care. Same thing with Central America. Actually, Central America is rated better in the context of overall quality of delivery of care than the U.S. So the opportunity to bring different models together ultimately creates a benefit for everybody. So insight is power, as some might say.
Tom, remember that what GenieMD is trying to do is we're trying to democratize healthcare globally. So we got to be expanding beyond the U.S. borders to achieve that objective.
I agree. Not only are you democratizing, you're disrupting and modernizing the health system, which actually is a topic in and of itself that we can have you come back on. But we are in the midst of trying to what they call reimagine the delivery of care. It's not just about the adoption of technology. It's about how you leverage technology in the midst of a delivery of care model. And maybe change up the way the older models where we can now become more efficient, more engaged, and move ourselves as consumers to a better degree of wellness, which is ultimately what everything is about. Is how do we all have the same end? I hate to say, but it's about how we get to the end in a wellness state versus a very different state if we don't take care of ourselves. Any last thoughts on that?
No, yeah, you said it extremely well. I think we're going to be not too distant in the future. You're going to be having wearables that are constantly monitoring your body. It's very much like some of the more modern cars. There are lights that will come on if something is not right, and the ability to respond to those lights when they come up is basically what healthcare is going to be about. And when one of these lights come on, we want to attend those lights at the person's home.
Interesting. So that's all the time we have today. I'm going to summarize the discussion as I interpret what you're telling me about GenieMD and as I understand GenieMD. One, certainly they are the vision that they have, the visionary nature of how you approach your business, leveraging a modular and scalable platform, ultimately Some might say, the ability to disrupt healthcare is a negative, but we're really trying to modernize and democratize healthcare globally. That's the GenieMD theme. Would you agree?
Exactly. Modernize, globalize, and democratize.
Awesome. So HIMSS 2022, if you're there, GenieMD is going to be in booth 4959. If you're not going to HIMSS, you can certainly go to geniemd.com. There's different ways of getting information, and certainly there's our contact information on the website. So feel free to register for some of our ebooks, or just request a call, and we'd be more than happy to engage. So Soheil, once again, thank you for participating and joining the virtual shift. I hope you have a great day.
Thank you, Tom. It's always a pleasure.
I would like to thank the show sponsors, both HP and Intel. HP Engage long lifecycle products provide the stability, safety, and security you need, plus flexibility and performance designed for today and tomorrow. As well, Intel would like you to know we're going above and beyond together with new standards for business with the latest Intel vPro processors, delivering what IT needs for performance, security, remote manageability, and stability. And be sure to check out the program page on healthcarenowradio.com. And remember, connect or follow me on LinkedIn, Twitter @FoleyTom, and follow the show's hashtag, The Virtual Shift. I'm Tom Foley. Until the next shift.